Link Zoom room. Republican Senator Jim Moylan standing by. Good morning, Senator.
Hi, good morning.
How was your
Good
COVID?
morning.
I'm sorry, last time you came on, you announced you got COVID, right? So how was that? Were you okay?
I'm clear. I did get the additional shots on a clonal shots too.
How,
That was helpful.
how was that?
I did my quarantine. That was really helpful. That it did reduce my symptoms, more manageable, and I'm feeling much better now.
What were your
I'm glad.
symptoms, if you don't mind me asking?
Sure. Yeah, of course, I had the headaches, and I think it was mild fever, but the difficulty was the swallowing with the sore throat, and then the congestion as well. That it just wouldn't go away, and that triggered me to go get the testing. I had the testing done before they required the appointment period, so I waited in that line, but it was done really effectively, and I tested positive, and then found out about getting the additional shots, and I went to get that as well. So I think I recovered quite well. I kept busy at home. Glad I was at my computer and able to do some Zoom meetings too. So I think I'm 100% better. I'm feeling really good.
Did you follow this guidance here? So you were, I'm sorry, you were boosted, right, Senator?
Yes, I was.
So
I was boosted as well.
You boosted, you got all the jabs, tested positive for COVID-19. Did you feel sick? Yes.
Yes.
So it said here you must isolate. Isolation may be discontinued after at least 5 days since specimen collection, 24 hours without a fever, and after other symptoms have improved. But you got the treatment, right?
Yes, and I got additional shots just on the safe side also, out of precaution, and it was helpful for me too. Yeah. So I did do the stayed at home. I had enough groceries, and I'm glad to do that, just to isolate myself, especially. I didn't want to get anybody else sick.
Yeah, because I was looking at this, and I think it's here. You are a pesky Republican senator, and then it says you must isolate forever and never come out again.
I'm sure they were wishing for that. Yes, right.
All right, the senator. So I wanted to ask just about this. So I was talking with somebody who is, adhering to this in the private sector, right? Gov Guam, these guys got, 5 years of leave on the average per employee. But this is a private sector employee, and they were a close contact with somebody who tested positive. And so basically they had to, and at the time the guidance in September was, I think, 14 days. So they had to quarantine for 14 days, but they had to use their sick leave, right? And then they came into close contact again like a month later, and again they had to dip into their sick leave. So I was just kind of thinking out loud here. Do you think with all this ARP funding that there could be something in the works where these people are compensated for having to take off their personal leave?
It would be nice to do that, especially for those in the private sector that don't have that leave available either, right? So that it makes it really hard. One of the measures we were pushing is that credit card. Give them $500 credit card using ARP funds, because if you can't use your personal leave in the private sector while you're ill and can't get to work, well, how are you going to pay for your bills too, right? How are you going to buy your groceries? So I feel that the ARP funds are there. They're not being utilized as quick as possible. And what's wrong with giving folks, especially in this situation, since we no longer have PUA, we don't have anything in the pipeline to help with that, then provide the credit card, do something. And especially now with folks there's so many hundreds getting tested, there's so many hundreds getting positive every day, going to be out from work. We reduced it to 5 days, but still that's like a week of pay for a lot of folks. You're just barely making it anyway with the full week's pay, and now to miss out on that, just one more stress when you're trying to get well, and that doesn't help the body at all deal with that. So yes, Chris, I think our ARPA funds could be used for that purpose, of course.
Did you see this latest release from Congressman St. Nicholas?
I saw some of it. I think this is regarding the hospital. Is that correct?
Yeah. And so I guess he's saying here, The Treasury issued their 437-page final rule on the use of ARP funds allocated to local governments, in particular projects in excess of $10 million, which the governor's healthcare complex would be, will require significant justification to include details on the use of funds and options for other funding mechanisms. And he goes on in here in this release to say, today we still have essential workers uncompensated, a tourism economy unready, no local solution for unemployed with the expiration of PUA, and an overall economic outlook that remains uncertain, all of which remains unresolved with the available ARP funding. And then he continues, nearly 6 months ago, we advocated for engaging the Army Corps with federal grant funding from the U.S. Department of Interior to do a charrette to properly plan and cost out our hospital solution, and that has not happened. Now with this guidance from Treasury, we can expect due diligence of that caliber to be done if ARP funds are to be used. It's vital that we get this project right and weigh out the realistic timelines and processes it would take to execute a project of that scope appropriately.
Yeah, I believe the charrette would have been really helpful for us to have that study completed by the Army Corps of Engineers. I remember attending that briefing, and there was a lot of information there that we can learn from, and these are their specialties that they could do and provide that for us. We still had that question of where this hospital will be built as well on the property that we're not too sure. Should we go back to the landowners and if they were all aware that their property could be maybe taken from them once again, and how this agreement has come across from administration with the Navy on the release of this property. So there's so much questions involved, and it's unfortunate. The transparency is not there either, and we're trying to get these answers because we do want to help. Like Congressman is saying, that the hospital, the needs of the hospital are great, and like the previous 35th Guam legislature, we were trying to give money to support the maintenance of the building in the meantime. And it was so difficult to try to get that money on over to the administration to utilize.
Yeah, that's crazy. You guys actually passed a bill in giving GMH $10 million. Here is $10 million. And they're like, no, we don't want that. No, we don't want, no, don't miss me with that 10 mil.
Right.
Yeah, that's crazy.
Yeah. So now if they're going to use some of this ARPA money for the new hospital, it's questionable how we can really manage this properly with how things have been managed thus far. Yeah. I've even introduced a bill for public-private partnership in the building of this hospital too, and to include the management of the hospital in the meantime, so our doctors and nurses can focus on what we do best, because we know the care that we gave to our patients is bar none. But the running of the hospital is so difficult. The administration, the processing, the billing, and the payments and the hiring process is incredible. So unfortunately, this is where we're at. But good Congressman is looking at it, and I think the 36th Guam legislature will continue to ask some tough questions too. But I don't doubt the hard work of our nurses and our doctors there, and wanting to do the best, but I have questioned with the administration's interference on where and how this is going to be built. And I'm glad questions are being asked.
Yeah, me too. Senator, I know you just got a couple minutes here. It's funny, as I brought you on, I was like, let's talk about this, and then it was like, oh wait, Congressman came out with this release, so we had to talk about that. But you're just a few minutes away from a public hearing. Care to share?
Yes. Well, we do have under Senator Sabina Paris committee, a public hearing today regarding disability-owned businesses. So we're adding a couple of categories to be included in the favorable contracting process of businesses that have 51% owned by folks with disability. There's nationwide, there's so many folks within every 100, there's so many folks that have some sort of disability. So one of the categories that we are including is basically just that it's the easiest one or not the easiest, but the most important one is with these people that are identified with disabilities through Small Business Association and through other organizations that identify or make the qualifications for that certify who is with disabilities. And once you have this category added to the public law, then you have more advances for contracts. You can bid up to 105%. You have the first dibs into these contracts, and a lot of folks with disabilities have to have self-employment because the difficulty of getting jobs due to disability. So one is your disability. If you have that, that disqualifies you. And two is if you're a serviceman and have disabilities after leaving the service, then not service related, but then you also will qualify for additional points in starting a small business and getting contracts. So presently, it's the servicemen that are disabled due to injuries or due to an injury that they sustained while in service. Now we're adding 2 more categories to that to help grow our small businesses and to help those with disabilities. So I'm looking forward to the public hearing today at 9 o'clock.
Right on. It is almost 9 o'clock, so we're going to let you go.
Yes.
Thank you, Senator,
All right.
for your time.
Thank you very much.
All right.
Talk to you later.
There you go. Senator Jim Moylan, Republican. Good morning. We did have some comments here. Yeah, please give those people who are under PUA, give them the credit card, $500. Please, Governor, look into this. Right on. Could you use $500, sir, on a little card, spend locally, like they did in the NMI? Yeah, in the NMI, their governor gave them $500 cards, right? It was like a debit card, and you had to spend it on